We begin by acknowledging the traditional custodians of the many lands on which we record, learn and practice, and pay our respects to elders past, present and emerging. Welcome to Dental Yap, the podcast from Collective Dental Education, where we get into the conversations that matter for dental and oral health professionals. I'm Lucia, and joining me is my friend, colleague and co-founder, Janet. We're both registered oral health therapists, and somewhere between teaching, the clinic and a lot of good conversations, this podcast was born. Because the mouth doesn't exist in isolation, and neither do we. Each episode, we connect with clinicians, researchers, educators and changemakers from across dentistry and the broader world of holistic health. People who understand that what happens in the mouth is connected to everything else, the gut, the body, the mind, and the whole person sitting in the chair. We talk to people who've faced real adversity, who've navigated burnout, broken systems, and moments of doubt, and come out the other side doing something remarkable. People who are quietly, and not so quietly, shaping the future of dental and oral healthcare in Australia. These are the stories that don't make it to the textbooks, the insights that shift the way you think, and the conversations that remind you and us why we chose this profession in the first place. So pull up a seat and let's have a chat. Hello, everyone, and welcome to our podcast, Dental Yap by Collective Dental Education. My name is Lucia Quinn, and I have my partner here, Janet Wallace.
Hello.
Today, we will be talking to Dr Angela Genoni about gut science. We are very interested to learn all about gut science and how it also relates to our oral health.
Hello, Angela. Thank you so much for joining us today. And before Lou and I start prattling on with questions and all that sort of thing, could you tell us about yourself and your wonderful book that we'll hear about, and just to give us a background of who you are, what you do and why you're here?
Yep. Thank you. Thanks for having me. It's lovely to be here today. So my background is nutrition and I've been in the nutrition and food space for my whole career. But I guess the reason that I'm here is because when my kids were young, I thought it would be a fun thing to do to go and do a PhD. And that PhD was looking at diet and the effect on the gut microbiome. And so for the last 10 years or so, that has been my area of research and expertise, is looking at the gut microbiome and how that has influences our health and our health outcomes and how it interacts with every part of our body. But as I was post-PhD life, I realised that there is a massive gap between all of that cool science that happens in the microbiome space and then how we use that in real life, whether that's on social media for real people to use, or whether that's in the health professionals being able to interpret all of that complexity and what it means for their own clinical practice. And yeah, I just have a personal and special place in my heart for linking the oral microbiome and the gut microbiomes together because they're part of the same system. So hence I'm here today, and hence why I've started my own business doing education, because I feel that gap between research and application there's a big piece missing there.
And you said you've got a real passion for oral health and gut connection. How did that occur?
That is kind of a story in itself, actually, because after I finished my PhD and was in the process of writing my book, I had my own dental issues, or a bit of a dental emergency, you should say, and I had an old bridge which was spanning my front teeth, which broke. And then I had needed a couple of implants, which is obviously major dental work. But then I got chatting and became quite good friends with the dental surgery that I was with for that sort of 6 months, and I still go back to see. And I've ended up doing a lot of education with them because they were so interested in what I do. And then that has sparked research in that collaborative space, and hence my own, working together, networking amongst more of dental professionals, because there's a lot of interest in that area, but not a lot of people to fill the gap in terms of that education to go with it.
Yeah, totally agree. There's definitely a gap, and you're definitely filling that, and that's fantastic. And I've actually read your book, which that'd be great if you can go into a bit of detail for us about your book. But I found it so easy to read, and had so much great information in it. So, and it's called A Peaceful Gut, Mind and Body, which I think anybody who's got any kind of bowel issues is going to go, that's the book I need to read. So I think the title is great. So can you tell us about that Angela, the book?
Yeah, the book
And the
came
content?
about a little by accident, actually, because I was putting together a sort of a consumer program to help people learn about their gut. And in the process of writing and collating all of the information for that program, I sort of thought, oh, this might make a good book. And so I put it all together and approached a couple of publishers. And yeah, here we are. So it's about it really is about the big picture of gut health, because I think the media and social media tends to lean into the clickbait research articles, which, it's great for science to get out there in the media, but science is meant to tell a story. It's meant to be many pieces of the jigsaw puzzle together, to be interpreted together. And I think as humans, it's our human nature to be quite reductionist in thinking sometimes, and we get caught up on those little details. And it's the big picture that is really important for gut health. And so I've tried to put all those pieces of gut health together to help people make sense of that and actually how they do that in real life. And so, yeah, the chapters go into all of the ways that the gut microbiome influences all of your body, but also what to do with that information, because it can be a bit overwhelming the way that it's presented sometimes. So it's sort of making small graduated changes and learning to be relaxed about it, because being stressed is not helpful either.
Yeah, that's a very good point, isn't it? Because we all know that our gut reacts to stress, and your book clearly points that out. There's a couple of things, particularly in your book, that are very relevant to dental practitioners, and that is vitamins and probiotics. And there's a lot of stuff out there about probiotics and what they do and how they work. But as you're an expert, could you give us a little bit of insight into your knowledge and expertise as far as probiotics are concerned?
Yeah, absolutely. And probiotics is such a complex area because there are almost an infinite number of bacterial species that we could use when we look at the species and strain level of a bacteria that we could potentially put inside a probiotic capsule or some kind of mouthwash or something and use to support health. Now, the problem is that when we research this stuff, we would only research one particular strain at a time, or a combination product which has got 3 or 4 strains in that capsule or whatever it is at once. Now, the problem is we might find an effect in that one study, but as you know, we need more than one study to prove anything in science. And so when all the other studies are using different bacteria or different species, and they've got different populations which they're testing and different sample sizes, different confounding factors, how can we be sure that there's an effect for any of them? Because we have not got that weight of evidence yet for many of these probiotic products, other than what's presented to us by the company that's selling the product. So I think this is an area where we need a little more caution, because weight of the evidence, yes, for some health conditions and for some probiotic species, they can be useful, but individual context is important. Individual microbiome health is important. Individual inflammatory responses are important. So we need, there's a lot more nuance here than what marketing tells us.
And I guess individuals are all starting from a different starting point with their gut microbiome. So what fits for one may not necessarily work for the next person, depending on where they are starting on their journey.
Absolutely. And I see on social media regularly that people have started a probiotic, but they're feeling terrible, and they've come to social media to ask if they should keep taking this because they feel terrible. And it's like they have this perception that probiotics equals good, and that they're not associated with any harmful effects. And so, yeah, it becomes very difficult to try and educate people actually they're not always good. In some cases, they could be doing you harm or they could be not helping, and you're continuing because that's the perception that's out there. So yeah, I think there's a little more education and nuance. And in terms of oral health, when I was researching all of the literature around the oral products for dental treatment, there is a big scarcity of evidence there too. A lot of products available for dentists, but not a lot of evidence supporting individual products and their effectiveness and their interaction with the gut microbiome.
That's really interesting, because we do see on social media there is a lot of, would you call it evidence-based, or a lot of influencers, I guess, or people
Yeah.
who are supported and being sponsored or endorsing products that they actually don't quite know what it's doing, but promoting these products without expert advice. And I guess that's why one of the reasons what we wanted to have you on this podcast is because you are an expert in this field. You've completed a PhD, you're writing an education program about the gut microbiome and how it relates to oral health for dental practitioners and for GPs. And that's really important to us, that we have someone, and we want to promote someone who is the right person delivering the correct information. So that's why we're really excited about your course that you are running. Do you want to talk us through a little bit about that?
Yeah, thank you. Yeah, and we've really firmly establishing ourselves now as an independent education and advisory group for microbiome education, and filling that gap between all of that cool science and then health professional use and also consumer use of that information and application of it, and helping people filter out all of the nuance and the rubbish that's out there. And then in terms of dental education, because of the link between the oral and the gut microbiome, and just discussions with dentists and dental professionals that I had, I thought there would be good scope for more oral and gut microbiome education as a continuing professional development option for dental professionals. So we've put together a four module program specifically for oral and dental health professionals, which goes into the links between the oral and the gut microbiome. And we talk about all of those probiotic nuances and the evidence around the application of some of those products in the oral cavity, but also the link between gut health and how that goes back again. And we talk about the oral microbiome and its role in blood pressure regulation and sports performance. So it sort of delves very much into the systemic connection of the microbiome, linking it with the gut microbiome and health outcomes. And then also we've included all of our gut microbiome content, which is to give the background content, which for health professionals is actually quite personally useful as well as being professionally relevant. So yeah, I've had a few dentists who've done my initial founding program who've said they've actually found it very useful personally as well. So that's been kind of nice too.
Yeah, I think that's just so good, because historically, dental and medical have been poles apart. And in the last few years, we're starting to really try to pull everything together and provide our patients and the general public with holistic care that involves oral as well as general. So I think this is just a wonderful step, and congratulations on pulling this together, because I think there's going to be a lot of people out there that will find this really, really valuable. One of the other things that I found interesting too were your comments about vitamins, because we see online all the time people pushing this vitamin, that vitamin, it does this, it does that. Could you give us a bit of your opinion on that too?
Yeah, sure. And I do talk about that in the book, because it is an important conversation to have, because and also especially for dentists, I mean, you need to be aware what your patients are taking in case you need to administer any medication yourself to patients. But as humans like to do, we know that vitamins and minerals are essential for us. And so we have this perception, and it's quite normal, that people think, okay, well, if, say, vitamin B is good for us, then more equals better. And this more equals better conversation permeates everything on social media. Just, you need to up your game. you're not enough unless you take these products. And that's how we are sold to, is that if some of it is good, then more is better. And so here buy our product. And so in the book, I try and help people understand the differences understand how the dietary recommendations are arrived at in the first place. So we're trying to avoid deficiency, but avoiding deficiency and having toxicity effects can be a fine line in the middle. So, and also that you can get everything that you need from food. And so there's no real need to spend a boatload of money on things unless you have them professionally prescribed to you. And I think the supplement conversation really should be reserved for medical professionals, because you only need, if you're vitamin D deficient, sure, you might need to buy a vitamin D supplement, but you only need the plain one. You don't need to spend $200 on a fancy one. They're all the same. So yeah, just trying to demystify that a little bit and help people see that there is a bigger picture there and you don't necessarily need all of that.
That's a really good point. You're just, I think Jen and I were both nodding along because we totally believe that about our profession as well, is getting the advice around supplements. We do talk about supplements with patients in terms of gaining a medical history. We like to know what people are taking, but also the recommendations to supplement for the benefit of their oral health shouldn't come from us as oral health practitioners. Perhaps maybe dentists, but also I don't know a lot of dentists that prescribe routinely supplements, but totally agree should be sent back to the GP or a nutritionist who is able to apply correct dosages, I guess, and what they actually need and require. It's much more within their scope of practice. And I'd like to also add on this podcast as well, when we were talking to Angela about your course that you've developed for GPs and for dental professionals and oral health professionals, it's not supposed to get you to work outside of your scope in terms of recommending issues or diagnosing anything with the gut. It's more so that you're able to have a conversation that you may be able to steer that person in the right direction of where they need to go to talk about their gut issues. Would that be correct in saying that?
Yes, absolutely. And also like providing some of that upskilling around education of the human body, because, you're working in the oral cavity, but what's happening in their oral cavity could be being influenced by what's happening in their gut. And so even, just mentioning that to the patient that, hey, we've got a bit of inflammation here. If you're struggling, if you're having any other gut issues, might be worth getting that checked out because it could be influencing what's happening here. Just planting that little seed within the patient that the body is connected. It might encourage them to finish their treatment, their dental treatments, and look after their oral health, which is, what we all want them to do, but also can encourage them to take better care and love and respect their own body better, because they can see the outcomes can benefit them with their own.
Yeah. And I do have a question around your thoughts with mouthwash and gut health. Is there any insights or information you'd like to share or knowledge about specific mouthwash and how it affects your oral microbiome, and can it affect your gut health at the same time?
Yeah, so there's a couple of points here that I want to raise, and then the first one is that one of the studies that I looked at was a systematic review looking at regular long-term users of mouthwash. So it didn't specify whether they were using like an alcohol-based mouthwash or like a chlorhexidine. It didn't specify that. Those regular users had higher systolic blood pressure than those who didn't. Now, the pathways, which I talk about in the program, is because the oral microbiome is very heavily involved with blood pressure regulation and through that nitrate, nitrite, nitric oxide pathways. So if we're continually our oral microbiome, then perhaps we're interfering with those normal regulatory processes involved in blood pressure regulation. So there's a cascade, a pathway cascade, which needs to be taken into account there. So it's not just that part in the mouth, it has to be swallowed and then uptake into the bloodstream. So there's a few other things in the process there, but that is one piece in the puzzle. So that is long-term use of mouthwash. I would, caution against whether we need to be using that. Obviously, in an oral health capacity, there's a time and a place for antiseptic mouthwashes when you've got active treatments going on, and they're very much needed. So that's we're not talking short-term use, we're talking the long-term use there. Now, the other thing is that when we swallow that oral microbiome, which we do every minute of every day, where that's a bacterial load that's entering the rest of our digestive tract. If our stomach acid is compromised, so the patient is taking proton pump inhibitors or any of the antacid type medications, what tends to happen is you get more of the oral bacteria entering the rest of your digestive tract. Now, in most people, this is not a problem, but if we take a stool sample and we test the gut microbiome, we can see that there's more oral species in your stool. So, and I had a client the other week, and she had high oral species in her stool sample. And I said to her, "Do you take proton pump inhibitors?" And yes, she did. And that was very, very evident with what the microbiome was telling me. Now, the only reason that's a problem is that those oral species in the colon are not necessarily desirable in higher abundances. They're meant to be there, but not in larger quantities. And there is an association between higher abundances of oral species and some digestive disorders. And we also know there's a link between things like gingivalis with atherosclerosis as well. So there are some health risks to having too many oral bacteria entering the rest of your digestive tract. And again, there's nuances involved because the stomach and the upper digestive tract plays a role in regulating that too.
That's so interesting. Stuff that I just wouldn't think about, really.
It just shows you how intricately the body is linked together, though, doesn't it? Like,
Absolutely.
yeah, it's quite beautiful. And I really do, I see the beauty of it in every paper that I read. I think, oh my God, that's fascinating. And
Yeah.
it's amazingly intricate and orchestrated to the point where it's like, wow.
Yeah. Yeah.
I think that really comes across in your book, the way you write and the information that you give. But particularly for anybody who's in any form of healthcare profession, to be able to read your book and get that information very quickly, very clearly, I think is so valuable, because if you think about all the health practitioners that people come across and go to for treatment, there's so many things that can happen to us that have some connection with our gut. And you're explaining that in your book, which is I think it's so valuable. I hope that all health practitioners find your book and read it, because they may just look at the way they treat and prescribe for their patients quite differently.
I hope so. And I guess that's my mission and my true desires for my business was to really help people understand in a compassionate way the way that the microbiome can support your health. And there's a lot of, and I should point out, there is a lot of compassion that goes into it, because I think particularly for women, we've been diets pushed on us for many years, and it's been a very restrictive and not healthy mentally thing to be doing. And so I'm trying to help flip the script around and help people see the wonder of their body from the inside out, so that we no longer have that superficial desire to be some standard, when really it's about how healthy we are on the inside, and look at the wondrous things our body can do, instead of focusing and zooming in on the things that we can't do.
Absolutely, absolutely.
Yeah.
And I think, and of course you particularly, Angela, would be aware, but Lucia and I am too, that the cancer of the bowel has really increased in Australia, and particularly in people who are under 50, which is really quite scary. But you say in your book about looking at the things that are in foods and all the preservatives, food colorings, all the additives, and how harmful they can be to us.
Yeah, and this is where it's easy to get caught up on details. So yes, that those things can be or could be. Science doesn't quite have the answers around the higher rates of colorectal cancer in young people yet. There's a lot of potential causes there, but if we keep our picture big and we focus on supporting our gut-brain axis by not getting too stressed about these things and eating a lot of fiber and whole foods and reducing our ultra processed food intake and exercising, then we're reducing our risk factors greatly. And of course, there are some oral bacteria which are also implicated here too. We know Fusobacterium, for example, has some links with colorectal cancer too. So there's many things going on that we could be addressing. We can probably address all at once with some more big picture thinking and being kind to ourselves and, doing the things we all know we should do, but it's about how we implement it in a way that's sustainable.
Yeah. Yeah.
Absolutely. That's the most important part is sustainable lifestyle choices, isn't it? Because it's pointless trying to adopt something that just is only going to be a week or two fix and then we fall off the wagon and go back to our old habits. So yeah, I think that's a really important point is also that being kind to yourself. I love it when you say that because we, especially women, I feel like we aren't very kind to
No,
ourselves.
we're
We are
not.
always looking to be better. And we're always, I feel women in general, there's a lot of standards that we feel like we need to meet. And that's actually doing us more damage than, helping us, I guess. Yeah. It's making us more unhealthy is what I'm trying to say.
Yeah, and I
Yeah.
think we can very easily get stressed about feeling like we're not enough. And
Mm.
that message is pushed on us daily. Social media is very good at helping us have that mindset because, we're told we need this and X, Y, and Z to sleep better and perform better. And that just makes you feel like you're not enough as you are.
Mm.
Yeah. So yeah, flipping that script around and providing that education from the inside out can really help empower people to see through some of that stuff. And I guess that's my mission, is to build people up by having that, seeing the wonder on the inside, because
Mm.
it's kind of cool, really.
Yeah. No, it's very
Yeah.
cool. Very cool. Janet, do you have any other questions about the book?
I don't have more questions. I wanted to talk about the oral health course, though, a little bit more, Angela, if that's okay, because I think that's really valuable. So I know you said that there's 4 modules in it, but will how will people get to it? I know that we're going to set something up on our socials so people can get to it, but how do they get to it? How long will it take them to do it? And how available is it? Does it start a couple of times through the year, or can you access it whenever?
Okay, so I've set it up so it's on demand. So I finished all the research and the recording about 2 weeks ago. So it's all done and there, and all the references are all in there as well. So there's 4 separate modules, and the course platform, I've even set it up with a little widget so you can pop it onto your desktop. You know when you download a course and then you can't find the login again to go back to it? I've
Mm.
sort of tried to solve that problem by putting a little widget on your desktop so you can go back to it easily.
Excellent.
Then you can, when you complete the 4 modules, you can listen to it on the go. It is set up in a slide format because there are some diagrams to help people understand the links between some of the bacteria or the gut and so on. It probably is good to be able to dedicate some time to watch those slides, but you can certainly listen on the go. Yeah, so it's all set up in there. There's also 16 sessions, which is the general gut background content as well. The oral component is about 4.5 hours worth of information. There's another hour and a half or so of gut content as well. We've put it in for about 5 hours of professional development, which we will send you a statement of attainment with the learning outcomes and what you've learned after the 4th module is finished. And you can access it or find us on my website, where we have got a specific page for dental professionals, which just you can see the module titles are in there, and there's a little preview of what's inside in there as well. I've had from quite a few dentists do the initial program already, and I've had some really great feedback so far. So, which is great. And at the moment, I'm also including a one-on-one with me, because I want to make sure that, firstly, that what the knowledge that we're giving you as oral health and dental professionals is what you're looking for, and two, just to help make sure you know how we can support you to have those conversations with patients without stepping outside any scopes of practices.
That's just so fantastic. Well done, you, because I just think what you've put together and the format of it, and then the evaluation and the opportunity for people to speak to you directly is quite remarkable. And don't be surprised once we get this out if you're going to get very, very busy, because we, as Lucia said earlier, we're so passionate about having the right people give the right message and providing that message to dental practitioners so that we can all do the right thing and, as you said, stay within your scope. So I think Lucia and I are definitely going to sign up for your course. It sounds
I was about to say,
fantastic.
Janet, we have to put this on our to-do list.
Yes, it's definitely on the
We need to
to-do
sign up.
list. Yeah. And I think too, one of the comments in your book, I can't remember the entire comment, but you spoke about really wanting to inspire people to find that passion and the will to live better themselves, which I think is a great comment. And then another comment really hit home to me, because as you become more mature in age, you look back on things and look at things that are happening now. And it seems to me that, there's a lot of things that people are doing to themselves that don't have research backing and have not been around for a really long time. And I really like the science behind everything that you've produced, but I also really like that comment about you want to inspire the next generation to be healthy, fit and happy, and that involves your gut. So, tell us, how did you get that sort of overview on everything?
I think that's been part of, my journey too. I guess I did my PhD whilst juggling 3 small children at home, and, I had a pretty difficult situation which I was dealing with at the same time, and I didn't have a lot of support. It just makes you very efficient with your time and determined, and it's really, I don't know, it's just given me a unique perspective on what it is to achieve things and at what cost and what's really important, along with all the science at the same time. And yeah, as I've got older, I've sort of realized that being extreme with diets is not helpful, and in fact probably does harm. And we know this, science tells us this, but it doesn't, young people can easily get caught up in that because they don't have that life experience perspective. So perhaps at an earlier age, if we can help people see the wonder of their human body, then they're less likely to get caught up in that stuff as they get older and have more self-respect to look after it. And I do think that's perhaps where we've missed a piece in terms of nutrition education, because we tell people what to do, but we don't help them see the why, and they don't have the personal motivation. It's about losing weight instead of them gaining something. Maybe we need to help teenagers set goals which are not superficial related, or help them create goals which are more in line with health outcomes, or going hiking or competing in a fun run, or healthy things, just helping people have that wonder for their body.
And that's wonderful. And that comes back again, doesn't it, to that comment in your book about trying to inspire people to find the passion and joy in feeling good, living
Yeah.
well and feeling good.
Yeah.
Yeah.
And once you have that, you can't go back. I think once people start to see that they feel better from, looking after themselves better, then the pieces fall into place. But you've got to get people to that point, and that can be challenging sometimes. And not everyone's interested in having that, and I enjoy working with the people that want to find that, because that is, that's what I'm here for.
So apart from all your research and your continued research and your business and your courses and podcasts, you also see individual clients, patients. Is that correct?
Yeah, I do
Yeah.
do a bit of one-on-one work. Mainly, I just help people they've kind of been a bit stuck, really. They've had all the tests done. They can't find anything wrong with, colonoscopies and endoscopies are all normal. And so that's the time when, I might help someone, and we organise a microbiome test, and then I help them and sort of interpret that information. So that is something I offer individually. But for individuals, I do have an education program as well, sort of an extension of what's in the book, really, but it's in video form. So for the people that are too cool to read books, then they can watch the video format.
Fantastic. I think there must be so many areas where this would be relevant. Anyone who's going through any cancer treatment, or anyone who's having a baby, or anyone with an autoimmune condition. The list would be endless, I'm sure. And they would most definitely, it sounds like, benefit greatly from that.
Yeah, I think although I don't specifically talk about those specific illnesses in my book or in my programs, but helping people work out how the system works is often enough to help people put the pieces together for themselves, because once they have a better grounding of what the digestive system is doing and how it's operating and all the bits and pieces and what things support the microbiome, often they can work it out themselves then. So it's just giving them that groundwork to empower them individually.
Wonderful, wonderful.
And just adding on to that, Angela, what do you think, this might be a difficult question to answer broadly, but broadly speaking, in regards to your gut microbiome, what is, I guess, the biggest bang for your buck that people could do to support their gut microbiome? I don't know, it would be very different for everyone, but if it was just a simple lifestyle change, what would your advice be?
So I think everybody knows that we need to eat more fruits and vegetables. And diet is the major driver of your gut microbiome composition. But so the message about more fruits and vegetables is not lost on most people, but it's actually doing it that is often the problem. So if your listeners just want to start somewhere, then the challenge for the rest of the week is to just add one extra piece of fruit into the diet, because you're getting a couple of extra grams of fiber, and that can be enough to help things be moving a little bit better. And then once you've got that nailed, then you add in something else. So we don't, my whole philosophy is we don't start with restriction, we start with doing something positive. And that something positive is just being really straightforward and simple, and adding something that you can achieve into your diet for the week. And fruit is an easy one because it's readily packaged, easy to go, eat on the go. So yes, fruit and vegetables is a blanket statement, but doing the one extra is often more.
Yeah, and keeping it nice and simple. But for some people that may be quite a stretch.
Yeah, exactly. I mean, you still have to do a bit of planning. If you tell yourself you're going to have an extra piece of fruit a day, then you actually have to make sure you've been to the shops and got some fruit. So, there's still a little bit of planning that goes into that.
Absolutely. My next question is a little bit about the pressures of social media. And this maybe for some reason pops up in my feed a lot. But what are your thoughts around, it's not a colonoscopy, it's like a fad that people do, and it's like they're rinsing their bowel, so to speak, and it's very, very popular on social media. I can't remember the name of it. It just escapes me right now.
Colonic irrigation?
The colonics or the enemas, yeah.
Yes. Please tell me your thoughts about that.
I get asked a lot of questions about that. And there was one yesterday on Threads. I responded to another one around drinking olive oil in the morning to flush out the system. I was like, oh my God. So with the colonics, you do risk disrupting your microbiome when you're doing that, because it's an ecosystem in there, right? It's like an Amazon rainforest. And so if you rush into the Amazon rainforest and chop down a whole section, then we've disrupted the balance when it didn't need to be disrupted. All it needed was a bit more fiber, and it would have,
more
moved.
support.
Yeah, exactly. It would have moved along okay on its own. I think that a lot of gastroenterologists would argue that, there is a risk for bowel perforation and all sorts of nasty complications from some of those fad things as well. So my scientific opinion is that they're not necessary, and that having adequate fiber going in will support the outputs.
Yeah, and that logically does make sense.
Yes.
But also coming back to the social media, and I know we do talk a lot about social media because it is a platform where all of us are consuming now. Like you can't sort of really put it to the back of your mind if you're in business or even in health now. Just the general public are very aware and get a lot of their information and news from social media. So I think it is important to address just what is out there and what people are being influenced by. But also when we go back to talking about being kind to yourself. So that's one thing that I see on social media. And I do think, I'm like, oh, maybe I should do that. Maybe that's going to make me feel better. Like it's such an easy thing. And I feel like I'm an educated person and can see weed through, the rubbish out there on social media. But something as simple as that, for me, even I think that too. Like I can easily get sucked down that, oh, that it looked like that really worked for that person. Maybe I should try it.
And being in business or taking science into business, I've actually done a lot of work myself in marketing and sales, and the way that you structure, your landing pages and your social media content. And they are so specifically tailored in sales psychology that they speak to your pain points so effectively. And then so you immediately resonate with some of these things and you go, oh yeah, that's me.
Yeah.
And it's human nature. Like we get sucked into those because they're so clever at speaking to us at our vulnerabilities.
Yeah. And creating fear, creating a fear.
And that's the problem with it. And I guess that's, social media is a very important part of what I'm doing. And I think I have most of my followers on Threads, actually, not on Instagram. But I do spend a lot of time myth busting on there and calling out the misinformation and trying to provide a voice to science, because not in a put down way, but just in a
you're correcting
helping people understand the true picture, because people appreciate that. Yeah, I mean, I've collected a nice community of people there now from doing that, but there's so much noise in that. In gut
there
health.
is a lot.
There's a lot of AI accounts out there too. Some of the advice from AI is obviously not terrible, but it's when you have the nuance and people ask questions that they can't cope with that.
Thank goodness for people with PhD.
Yeah, I think maybe I need to put in my bio on Threads that I'm a human. I don't know.
Yeah.
Yes.
Just to differentiate.
Yes. I got my PhD prior to AI.
Yes, yeah. And my book was written. My book didn't even have Grammarly touching it. I was so worried about that, actually. And someone emailed me to tell me there was a typo on some page. And all I could reply with was, at least I didn't use A.
Absolutely. Yes, I'm proud of that typo.
Proud of that typo, yeah.
Yeah. I also love the graphic of your book too. That was
thank you.
Yeah, it's really good.
Thank you. Yeah, I wanted to encompass that, compassion with the system, and I think that spoke to what I was trying to portray.
Well, you totally achieved that. And do you have any more questions, Lou?
No, I think I'm okay. Angela, is there anything else you want to talk about to be included on the podcast?
No, I can't think of anything else. I think we've had a pretty comprehensive chit chat.
No, it's been excellent. Yeah, thoroughly enjoyed it. And I do want to know more, and I do want to sign up for your course.
Thank you.
Yeah.
We should sign up
Absolutely.
before 30th of June because we will be.
Oh, yes, your prices are going up.
Yeah, we will be putting
Yeah.
the price up. Yeah.
Yeah. No, we'll definitely look into that. Janet, do you have any other questions?
I
for our
don't have any
guests?
other questions, Lou. The same as the comments you've made. I've really enjoyed it, and I really, again, enjoyed the book. In fact, I highlighted some paragraphs because I love how you can do that because I downloaded it. I didn't have
Yep.
time
Yep.
to get the hard copy, but I think I'm going to order the hard copy too. But anyway, long story short, I highlighted a couple of paragraphs and sent them to a few family members and read this, please, read
Thank
this.
you.
And the other thing I think is, I think you should approach the universities and say, this is valuable, this stuff, gut health, oral health, the connection. The students need to know about this. So I would really encourage you to get in contact with all the universities in Australia and say they need to put this into their curriculum.
Yeah, that's a great idea. Thank you. I'm going to probably submit an abstract for the next dental conference as well.
Great.
I've put an abstract in for a microbiome one next month
Fabulous.
just to highlight the gap for education between research and the research
Fabulous.
translation piece. But yeah, I agree. I think that's a nice piece to round out everything that I'm doing. And yeah, I do want to just get the message out more. It's I'm very passionate about what I do, and I feel very blessed to be able to do something meaningful with my education.
Well, your passion definitely shows, and your research and your knowledge shows through, and we need more people like you working in their particular spaces. So from Lucia and I, thank you so much for speaking to us on the podcast today. We're very proud to be able to show you maybe we're the first dental people to push your gut health and oral health. So we're very happy about that. We wish you all the best, and I'm sure that this won't be the last time that our paths cross. So thank you so much for joining us.
Thank you so much for having me. I really appreciate it.